Hi there, this is Dr. Brett Bingham from Intermountain Pet Hospital talking to you about the question of the week, and that is, if my dog has a food allergy, what could it be allergic to? So we're talking a little bit about that for a few minutes, and I will tell you, I'll give you a little warning, my approach to food allergies is a little bit different than most veterinarians. A lot of veterinarians will approach an itchy dog first by changing their diet. They'll recommend a hypoallergenic diet. My approach is I usually do that at the end. Okay, after we've failed everywhere else, we'll do the food trial at the end. And the reason why is only 15% of all allergies are a food allergy. So why are we treating so many dogs with a different diet right at the beginning when only 15% of them are going to improve with a diet change? So I like to do it at the end. So as far as doing a food trial, I do everything else first. I make sure it's not parasites. I make sure it's not an environmental allergy. I make sure there's no infection. And if I've taken care of all of those issues, then I'm left with, and the dog is still itchy, then I'm like, well, it could be a food allergy then. And then we do a food trial. Now, this is the thing I want you to remember. A food trial has to be done with a prescription diet. And the reason why, a study came out about a year and a half ago, and they took all of the over-the-counter hypoallergenic diets that were for food allergies, that were either grain-free or they had, venison and potato or rabbit and green pea or any of those hypoallergenics, limited protein diets. Only 15% of them actually had in the bag what they said. 85% of them were contaminated with other ingredients, which means 85% of the time a hypoallergenic diet that's sold over the counter isn't going to work. Okay, prescription diets have to have very, very strict regulations. They have to use that equipment to make that food and that food only, so there can be no contamination with other things. So prescription diets work. Prescription diets would be something like Science Diet, DD, which can either have venison, rabbit, or fish. ZD is another one made by Science Diet, and that's a chicken base, which is broken, it's hydrolyzed, which means it's broken down to a small component that they can't have a reaction to. Purina makes one called Ultimino, which is a great food. So there's a lot of them that are prescription foods that work really well. But the key is, make sure it's a prescription food. Okay, so if you look at this diagram here, you'll see the most common food allergies that a dog or a cat can have. Now, you have to remember that only 15% of the time, if a dog has an allergy, it's a food allergy. So I'm only talking about the patients that actually have a food allergy. So if a dog has a true food allergy, most of the time it's a chicken allergy. The second most common is beef, and then dairy, and then egg, wheat, and corn. Corn often gets blamed a lot, but you can see it's not very high up on the list. Cats, it's number 1 is beef, 2 is dairy, 3 is fish, 4 is lamb, 5 is wheat. So those are the most common things that a dog or a cat could be allergic to if it's truly a food allergy. And like I said, only 15% of the time is it actually a true food allergy and nothing else. Another reason why I recommend doing this at the end and not the beginning is hypoallergenic diets are expensive. You can spend hundreds of dollars trying all of these different diets, and in the end you're still dealing with an allergy, which is probably an environmental allergy. So instead of spending hundreds of dollars trying different foods, spend your money getting a diagnosis and treating the right diagnosis rather than experimenting with lots of different foods, because it gets very expensive trying a bunch of hypoallergenic diets. So that is my take on food allergies. Hopefully it answers your question, and we'll follow up more with more allergy stuff in the future.